Hi, everybody. Here we are again with another episode of putting some fun back into our dysfunctional lives. My name's Amy. I'm a psychotherapist with over 35 years of experience, and I'm here with my friend Buck, who I've known since seventh grade. Go, Buck.
Hi, I'm Buck. I have known Amy since seventh grade. I have been in psychiatric care, therapy, etc. since since fourth grade. I have been medicated with every medication you can imagine. Currently, recently, I've been diagnosed bipolar, which I think is the right diagnosis finally, and on medication. Today, we're going to talk about frustration with medical care, not getting it when you need it, or not being believed. But first, we're going to talk about, what our daily dysfunction might be, something kind of
Yep.
funny and might not seem a big deal to you, but to us, it just kind of overpowers us. So, Amy, I'm going to ask you what your dysfunction lately has been.
Well, we had to move a lot of the furniture that we have out in the garage, and like kind of figure out where things are going to go because we totally redid this house. And I had this rocking chair that belonged to my grandfather, and I let myself get fatigued because fatigue for MS is not, it's not fatigue like, oh, I'm so tired. It's fatigue like your muscles just go to entropy, like just things just quit working. So I let my legs get overly fatigued, and instead of like figuring out how to take care of myself, I managed to fall on my ass. And when I did, I hit the runner of this rocking chair that I had that belonged to my grandfather, and I broke it off. And I that my it's just a thing. I get it, and I'm not sure if it's worth fixing or not, but I want to because it belonged to my grandfather and it's meaningful to me. So that's the kind of stuff that I don't think happens unless you can't walk very well.
Yeah.
my that's my major hobby is walking without scraping my knuckles on the floor. you know. So
uh,
anyway, my dysfunction, and it's not a big deal, but it is to me. So
yeah.
what was your book?
Well, I started. I had a rehearsal for a short film that I'm doing this weekend, and it's it's actually not written very well. It's
Yeah,
not that it's not written well; it's just kind of obvious, and it was very murky. So there's characters that have had some sort of evil doings in their past, but they were all kind of the same,
yeah,
and the person who is grilling them and kind of putting them through torture, turns out to be the devil. So,
mm,
which, okay.
okay,
So in
yeah,
the beginning, they're all trembling and they're all scared, which, I said to him, there's nowhere to go from that. If they're
yeah,
all scared and they're all the same scared, then there's no difference between them, and
right,
they're all different characters. And so you know, he kind of agreed with that. He agreed with that. And
good,
he kind of changed some things, but we changed a couple of lines. But my dysfunction is that then I want to start to take over because I've done my own film and I've directed
yeah,
stage plays, and I have to stop myself because I have to say to myself, it's not your project. Nobody
right,
asked you. Nobody asked you. It's like those progressive commercials about becoming your father.
yeah, yeah.
Nobody asked you, you know?
Nobody take over.
Yeah,
Yeah,
nobody asked you. You have no right to tell them it's not your project, but I
right,
want it to be good. I don't want to be in something bad, but I think it's getting better. So I hope by
yeah,
this weekend. But my dysfunction is I guess I'm OCD and I want to micromanage everything and I want to like take over a project and I want to tell them
yeah.
what's wrong and I want to, and this is something that he wrote
I
like,
think that,
I don't know, he said like 2 years ago and that he, has been working on this with producers and stuff like that for a while now. So it's kind of his dream. So,
yeah,
it's not my dream, it's his dream. All I'm doing is acting in it. So, I have to but there's a certain amount of, I want to have a good character and I want the character to be believable. And
Yeah.
in any theater piece, as in life, you have the character, the person has to evolve.
Right.
It has to start at point A and it has to get to point B. You can't be at point B
Right.
already,
Yeah.
because then there's nowhere to
Yeah.
go. It's like I used to tell people when I would, because I, as a stage director, I would give people freedom, and I would say, first of all, I said, well, okay, now we're on stage, you know the song, um, do what you think you should do. I give them the
Right.
freedom so that they understand then when I give them
Yeah.
the blocking and the boundaries, why I do it. So 9 out of 10 singers will end up within seconds at the front of the stage,
Yeah.
right? They've got the whole
Yeah.
stage, but they end up
But
at
they
the
want
front
to
of
be at
the
the front.
stage. And then I stop them and I say to them, so where are you going to go from here?
Right.
I said, the only thing that can happen now is that your
Is go back.
voice gets more tense, it gets
Yeah.
louder, it gets
Right.
higher, you go off pitch because there's nowhere to go.
Right.
So use the whole stage. So then I have them do it again. Some of them find it, but 8 out of 10 end up at the front of the
Yeah.
stage again. And
Yeah.
so everything has to have an evolution. And, I can see
Yeah.
it so clearly, but I have to realize that not everybody sees that, especially young artists. They have to kind
Yeah.
of find it out for themselves. So my dysfunction is to stop myself from, it's not my business, it's not my job. They've worked
Right.
with producers. It's their thing. So
Their thing. Yeah.
yeah,
Yeah.
but I
That
have
exact.
to. There's one line in there. It's
That's just so bad.
oh, he goes. You're
Yeah.
probably wondering why I ask you all here, or why you're all here. It's just like, oh my god,
No. Don't
really?
click.
I expect
Okay.
like an old guy on PBS to turn around with
Yeah.
a cigar in a smoking jacket, turn around in a chair with a
Yeah.
book in his lap, and just
Yeah.
it's like, really?
Yeah.
That's the
Cliche.
line? That's the
No.
line? Oh, my God.
Yep.
So anyway, I hope he doesn't see this. Um, I doubt it. But oh my God. Anyway, so today we're going to talk about um, getting frustrated with, communicating with doctors or medical, personnel and really in pharmacies and
Yep.
how sometimes they don't listen or it has to go through all these different channels for them to
Right.
actually get you what
Right.
you need. And,
Yep.
I think that pretty much I've been, it took me a year, but then I got a psychiatrist who specializes in bipolar, even though he's a resident and he'll be leaving in
Right.
February and then I'll get somebody else. But like, I got he diagnosed me. We went through all these
Good.
tests and he really diagnosed me. And I got this medication. And
Mm-hmm.
the anxiety medication didn't really work that well, but
Yeah.
the sort of mood stabilizer worked, for a
Good.
while. But
Yeah. Yeah.
last week, I the last appointment I had with him was like 3 weeks ago, and I said, and I've told him this before. I said the anxiety meds really aren't working. I mean, I could take
Yeah.
them, not take them. I don't really. Are they
Doesn't-
placebos? Are they, And it's always up the dosage, and I'm like, but they're just not working. So I don't know what
Right.
up the dosage is actually going to do because they don't change.
Right.
They don't change the anxiety. I still have
Right.
a loop running in my head. So supposedly he's going to consult. I have an appointment with him next Monday. He's going to consult with the
Attending.
attending
Yeah.
psychiatrist
Yeah.
who he's going to see what she says. But he said, but your mood stabilizer works. Well, last week I got really, really depressed again. And that's not really supposed to happen. I mean, I got really, really depressed. I went really far down.
But it had been working.
It
So
had been working somewhat. He asked if it works. And I said, well, I don't get really, 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 really depressed,
Yeah.
to the point where I
The swings
drink
aren't
or
quite-
something. Right.
Oh, yeah.
But last week I did.
Yeah.
Last week I did.
Well, in that case, because it was working, then that might be because you need a little higher dose.
Right.
With the anti anxiety, if it would never work at all, then upping the dose seems like it's not going to do much good.
Right. Right.
So, I'm not a doctor. Disclaimer: no medical advice
Right.
from us. But it seems that if it doesn't work at all, upping the dose is just going to make you be taking more meds
Yeah.
instead of doing it for you. But this mood stabilizer worked, and your body got used to it, and now it might need another little boost of it.
Yeah.
That's that. Yeah. So yeah, better mood stabilizer, and maybe different antidepressant or something. And who
But,
knows?
it makes me wonder because I haven't been on this regimen of
Right.
medication, sorry, for that long. And if I already
Right.
need upping it, is it the right mood stabilizer to begin with?
Yeah.
Last
Yeah.
last appointment, I had my head in my hands, and I said,
Yeah.
"Please give me something. If it's clonazepam, I know it's a benzo, but give me something
Yeah.
to make it
Yeah.
stop." And I said,
Right.
"You don't know what it's." And he goes, "Well, there's therapy, which I need to actually look into, but when you're depressed, you don't really want to do that."
I know.
Um,
That's the
I need a therapist who specializes in bipolar, and uh, because my ex-husband, I have to be on his private insurance plan, which they've introduced into Canada. On top of
yeah.
the provincial, is that I can only have $400 a year, or
Yeah.
$400, whatever their term is, 6 months for therapy, which isn't enough for therapy.
Oh
That's not enough to
no,
pay
that's
for therapy. I'd have to pay for a lot of it myself. And if I
yeah.
do provincial, then I have to wait probably a year and a half to finally get assigned to someone. So it's
Yeah.
frustrating either way. But I I said I don't think the therapy is going to help the loop in my head. It just plays and
Yeah.
plays and plays, and I need something to interrupt it. I need
Right. Right.
something strong.
Because you thought stopping or do something, but it sounds like it just comes right back anyway.
Yeah, it just comes right back.
Sounds like
I
earworm.
you know,
Yeah.
and he's like, "Are you
Yeah.
hearing voices? Or you?" I said, "No, but I think that people are thinking about me, that I did this, and that they're coming for me. I don't know why." I said, It doesn't make any sense." I said, "I'm not psychotic.
You
I'm not
right.
psychotic. I don't actually believe that someone is outside my door." But I said,
No,
it's
it just like that, and then the thought
yeah,
keeps coming.
right. So, I
Yeah.
mean, have you experienced, or do you know what that's like with MS, or people that have MS? If you've
Um, I don't know that that's true of MS. I mean, mental disorders happen in MS, and partially because it's situational, partially because you're losing so much, and that causes depression and anxiety, all that kind of stuff. But it's not like clinical in the sense that it's not like free floating. It's not just like your brain manufacturing this stuff. But it sometimes it is because everything can get impacted by MS. They say something like it's the beast with 1,000 heads because it can do anything to you because it's impacting on your neural system, which is everything.
right,
So, because I had a pacemaker put in this summer, and I because I went into the hospital. I was having AFib with pauses, which means that your heart is stopping briefly. So they had to put in a pacemaker, and that is an MS symptom that it impacts on your muscles and your ability of your muscles to do what they need to do. So a lot of MS patients have problems with their heart and that kind of stuff. So there's absolutely many 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 patients of MS have mental issues because it's impacting on your brain,
right,
stuff like that. So it's both situational and kind of more
right,
physiological, but it's different than just physiological anxiety that's part of your psyche. That's sort of separate.
right,
So, that's and for you it doesn't sound like it's necessarily about like your thinking or it is about your thinking, but it's about intrusive thinking that you don't have a lot of control over.
right.
And that's what makes it difficult is because it's just it just happens, and you can use all the little tricks and tools and all that kind of stuff, but it doesn't sound like it's
No,
putting an
because
end to it.
it always comes back. And
Yeah.
um I get very frustrated. I feel like I'm not being listened to. We'll see what he says on Monday
Yeah.
because I had my head in my hands last time and I was like, please do
Yeah.
something.
I just can't.
Please do something about the anxiety and the loop in my head. I mean, this is not working. I said, are they a placebo when you're trying a new medication out? And I got the placebo because there's really no change. I
Yeah.
mean, is it,
Right.
you know, this is why I came to you. And so if I need something
Yeah.
strong, like an antipsychotic or something, I said, then please give me that. I said,
Yeah.
any, any, vacation from my brain, any
Right.
way to get out of this. I said, when you live with it all the time, you know, he's like, well,
Yeah.
are you, do you feel like you don't want to live anymore? And I said, yes. I said, will I kill myself? No. I said, but
Oh.
I don't want to live like this anymore. I've lived like
Yeah.
this
Yeah.
most of my life. And I said, and people who have this don't want to live anymore because they don't want to
Oh yeah.
have,
Because but it's not about wanting to be dead most of the time. It's not about wanting to just like quit everything. It's
right,
about I just can't stand these thoughts
right,
anymore. I can't stand
right,
feeling this
right,
and you just want the feeling to stop.
right,
I get that.
right. I said, I
Yeah.
don't want to kill myself. And rather not die, but I need a break. I need a
Yeah.
break from this. And
Yeah.
so, you know, and I discussed with him that, people, Canada now has MAID, which is the medically assisted
Yeah.
induced death.
Yeah.
And
Illinois too.
they're considering it and it's being in the courts. I don't know where it is right now, but for people who are mentally ill.
Right.
So
And
there
escaping.
was a case I was reading about with a woman who has been schizophrenic like most of her life.
Yeah.
And I think she's like 42 and
Yeah.
she just is done. She's done with the
Yeah.
medication. She's done with being crazy. She hates the medication. She hates when she's not on the medication. She can't control it.
Right.
She's like, I'm never going to get better ever. So I think this is the one
And
that's
have
in court now.
with
I'm
this
never
all the
going to get
time.
better. They're not finding drugs for this. I just want to go because I was born
Yeah.
with a bad brain. Like I was born
Right.
with something broken
Right.
and I can't,
We're wired working. Yeah.
yeah, and I can't function in society. I can't
Yeah.
live by myself. I have to live,
Yeah.
I think she lives with my
Somebody
parents.
else has to take care of her. Yeah, because she can't function
Right,
in a normal way
right,
because her thoughts are just not cohesive
right,
and comprehensive.
right.
Yeah.
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 So that's
No, I've had a couple of people with like such severe anxiety that they just say, I know someday I'm going to want to just shoot myself because I can't stand to have these thoughts in my head. I want to blow my brains out because
right.
they're not working. Wired for trouble, please to say. Yeah.
Yeah.
Are
Yeah.
we-
I mean, we're not
yeah.
advocating shoot yourself in the head, obviously.
No, don't do that.
Don't do
No,
that.
I always,
Get some help.
yeah.
But
Yeah.
yeah,
I
it's
optimism that I'm sorry. You go ahead.
no, it's just as much a medical issue as something physical within your body.
It
Having
is.
heart problems, if you can't, you know, people that are terminally ill, with cancer or
Right.
something. I mean, schizophrenia is basically severe schizophrenia is terminally ill. You're never going to
Yeah.
get better.
Yeah.
You're never
And
going to get better.
them into like we used to stick them into like mental hospitals that are long-term mental hospitals, and that's not pleasant.
No.
I think I said something about this recently to someone, or maybe it was here, but we used to go the youth fellowship at our church
Oh
used to
yeah,
go to the Fulton
yeah,
and do like a little kid or whatever. Yeah, we talked about that
yeah,
before.
yeah. My
But
mother used to say.
it was so sad, huh?
My mother used to
Just
say, "You kids, you're going to send me to Fulton."
yeah. My uncle Al ran was the head doctor there for a while.
Really?
My great uncle. Yeah,
Wow.
yeah, it was his job. Yep. he lived in Jeff City, and he would commute out there. And
Oh wow.
Uncle Al, my this is kind of off the subject, but sort of the same. But my grandfather had 9 brothers and sisters, 6 girls, four. There were 6 girls and three men plus my grandpa, and all of the women married ministers. 6 women married ministers. My great grandfather was a minister. My grandpa and 2 of the brothers became ministers, and my uncle Al became a psychiatrist because he used to say somebody has to take care of all those crazy ministers. Anyway, but so he ran when we used to call it the Fulton Funny Farm. It was
Yeah,
terrible. But
yeah,
I always felt so bad for the residents who they just were like so out of it. And we used to do little skits and all that kind of stuff. And I had
yeah,
one lady who came up and said, "Hi, my name's Mary, Queen of Scots." And
yeah,
she really believed she was, but it was like they were just housed, and it
yeah.
was not no quality of life
Well,
and
you
uncomfortable.
missed it
And
yesterday. Trump, in his speech of his
yeah.
accomplishment, said he was going on and on about playing baseball by a place in Queens with bars on the window, and I'd say, "Oh, by the way, she told me I was the best baseball player. I could be a professional."
Oh,
Mommy,
yeah.
why are there
No.
bars on the window? My mom was a wonderful
Yeah.
mom. She said, because there's sick people in there. They have to, and he goes, so
Yeah.
I'm going to sign an executive order to bring back the mental institutions. I want to build the mental institutions so the homeless people have somewhere to go. So those mental institutions were horrible. They were the
They're not
worst.
good.
They were the worst.
Yeah.
They had the
I know.
worst
And
conditions.
you know,
There
yeah.
really were
And it's
trapped in
it
there. You could be,
yeah. Yeah.
women could be committed for any reason by the husband, you
Yeah.
know,
Yeah. Years ago.
which
Yeah.
I think could happen again for anybody that, the Trumpers don't like. They could be committed to the,
Yeah.
you know,
It could be because it becomes like a punishment.
yeah,
Yeah.
yeah.
Not being as whatever as you're supposed to be.
No, but
Yeah.
I was going to ask you, since there's a lot of
Yeah.
different drugs for MS,
Yeah.
and a lot of people have variations of it, I guess. Um,
Yeah.
have you
Well, there's 3
experienced
primary kinds.
have you
Go ahead.
experienced the wait and see moments of MS, or know people that have?
Well, yeah, I mean, that's when I first got diagnosed. I didn't want to be on anything because I had just had my son. He was just a year old when I got diagnosed, and I really wished that I could have had more kids. And so, when all of those meds are abortifacients, they will make you miscarry. So, or at least the ones that were prominent. And I don't know about all of them, but I think they probably are. So I just really resisted it for about a year. And after about my third time of having another flare up of it, I was feeling like I just have to. I have to.
Right,
So I went on what's called Avenex, which was a once a month intramuscular shot. It was once a week intramuscular shot. So you take this needle that's about this long and you plunge it into your body
right.
once a week, and it was just and you had to like vary it. So you did it like arm, like you go down your arm, down your leg, because if you did it in the same spot every time, it would cause a breakdown in the tissues and cause like gangrene and shit,
Right.
which would be lovely. So, but and I used to joke like on the days that it was in my butt, I would go over to my husband and I would put my butt in his face, and he would sit there and go like this,
Uh,
watching the television, give me a shot, and I would turn around and go, "You are a pain in the ass."
right.
So anyway, not really, but that was just kind of funny. But so that one didn't really have much of an impact on me. So then I was on something called Betaseron, which is also a shot, but it was a skin pop, just like a tiny needle.
Okay.
And that also had to be carried, and that one didn't work as well either. And then finally I got on something called Tysabri, which was a once a month infusion. And that seemed to be working. Like you had to go to the cancer center and they would hook you up and you'd get this infusion, and like it only took like an hour. I felt bad for the people getting chemo who had to be there for like 3 hours sitting in
Yeah.
those chairs. But so I would do that, and then I got the shingles on my face and in my eye, and my doctor said you can't have the Tysabri anymore because it's they're all
Right.
immunosuppressors. So so then he put me on something that now what I'm on is Tecfidera, which is a twice a day capsule. So it's a lot easier than having to give myself a shot every
Right.
other day. And my doctor did say something because I had just a horrible summer with lots of like medical issues that didn't have really that much to do with the MS, but it impacted on the MS because it made me feel like I was getting worse.
Right.
And the doctor said, maybe you've been, I don't, he wanted to make sure I haven't been thrown into primary progressive. So the MS thing, there's benign MS, which is some people just have one or two little episodes and then it kind of goes undercover and it doesn't appear again until much later. I think my one of my dad's cousins had that where she didn't have MS, but when she got older, she started to have flares that were MS like,
Okay.
and she had some flares like early. And then there's remitting relapsing, which is probably the most common, which means that you have it and then it remits, then it comes
Right.
back and you have to manage those. And then you have primary progressive, and they're all progressive.
Right.
They all get worse over time. That's true. But the remitting relapsing is a slower progression and easier to manage. The primary progressive is when you get it, you just get exacerbations and it just gets worse and worse, and
Right.
you never really.
Right.
And my doctor did say, my neurologist last time said, I hope you haven't moved into primary progressive. And I don't think I have because I had an MRI and there were no new lesions, which
Okay.
is a good thing. But it just gets, it just every year it's a little bit worse. And, uh, I notice it more and more, but I'm still on my feet, sort of. So I don't want to complain about it. But yeah, it just took a really long time to find the right meds.
Right.
And the one I never went called Copaxone, which is also an every other day shot. And now there's new ones too. There's one called Orcavis, which you get twice a year, but it's $50,000 a dose.
Wow.
You get it twice a year. Yeah. So, and they're all notoriously expensive. It's terrible. And part of that's because the pharmacy knows they have a captive audience. You're never going to you're never going to not have it.
Right.
And so they can sell you these meds at these exorbitant prices.
Right.
And, theoretically, like some of that med goes into research and some of that money goes into research and, you're paying lots of different people within that, that's why pharmacy, that's what makes it expensive, but
Right.
it's still, there's just no reason for it to be as terribly high as it is, especially when there's no guarantees that it's going to work for anybody. In fact, one of our mutual friends, uh, who lives in Missouri, she's not on anything. I don't, because I think she just feels like it didn't work for her. None of them work for her. So, and that's the problem with any med on anybody is that some things work and some things don't,
Right.
and it's all trial and error. And there's a reason they call it practicing medicine because, or you're just practicing getting better at stuff,
Right.
So,
But it does get
yeah,
frustrating, and when you feel also that
so
you're not being
frustrating.
listened to, but frustrating when you try
Yeah,
medication and they tell you it works and then it doesn't work, and then trying to convince
right,
the doctor to give you something else, and then
right,
going through all these different medications and still not getting better, and then, finally finding the one, but then after a while the dosage isn't enough, or
right.
it fixed whatever, or it kind of made better what you had, but you're progressing, your illness is
Right,
progressing, so now you need something else, not knowing if that's
right.
going to work either. That's so frustrating, and I know it's frustrating for the doctors. It's just that
Yeah,
I wish they would listen more. I wish that they would
right, right.
really understand, because, like HIV doctors, and it's very rare that an HIV doctor has HIV, and it's very rare
Yeah.
that a psychiatrist. I mean, I don't know, but I would think it's pretty
No.
rare that a psychiatrist is bipolar, but it could be. A lot of
Yeah.
therapists have been in therapy forever, so they became therapists because they thought I could do that.
Right.
But it's getting this sort of empathy, this really understanding of being on the same level as we are, and not looking at it from a medical standpoint, but from a
Right.
human standpoint, where what's going on in their head, what's going on in their body, really
Yeah. Yeah.
what must they be dealing with every day. So
Right.
that's
Yeah.
that's
Yeah.
the thing.
I've been very fortunate that I've had some good doctors. The first neurologist that diagnosed or that I went to an ear doctor first because I lost hearing in one of my ears, and I thought there must be some kind of really bad infection. That was my first symptom. And he said, "There's your ears are beautifully clean." He sent me for this evoked responses test. I don't really know what that means, and then an MRI, and then the neurologist that I got referred to was the one who actually gave me the diagnosis.
Right.
So, but he started off talking to my husband instead of me, and because I'm crying, I'm going, I don't understand what's going on, and so he's talking to my husband, and I go, no, no, I don't care, as long as I'm crying. You talk to me, it's my body, you know, and like I'm sobbing. So he learned very quickly that I was going to advocate for myself,
And I think
and
that's,
that
yeah,
you know,
you really
yeah,
do have
major,
to advocate for yourself, and you have to
yeah,
push the doctor.
absolutely.
All right. Well, that is our topic for this week.
Yeah,
And
yeah,
we will see you next week. Remember, you are your best own advocate. So if you don't
absolutely.
get what you want from the doctor, either go to a different doctor or really make it plain
Right,
to them exactly what you need and what you're not
right.
getting. All right. See you next week.
Yep.
I'm Buck.
Okay. Bye, guys. I'm Amy, and we'll see you soon. Put some fun back into your dysfunctional life.
Bye.